Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back to Between Two White Coats, and today we have Jane Robinson. Jane, what are all the letters behind your name? You're social work, you're therapy, you're a coach, you're all the stuff. Give us your credentials.
So the LMSW, Licensed Master Social Worker, and then the CPSC, Certified Psychology Sports Coach.
Okay, fabulous. Awesome. So Jane is joining us today, and we're going to talk about the relationship between mental health and physical health. Amber and I have had way too many experiences where people come in and they're sick and they don't feel good, and we can't find anything physically wrong. They're tired all the time. They hurt all over. They have stomach issues, irritable bowel, constipation, diarrhea, chronic headaches. It could present as anything. I can't think of something it couldn't present.
And in patient's defense, I always tell them, I will work it up. Like, if you have a symptom, I'm working that up. Like, I want to make sure we're not missing something.
That's exactly
and
right.
Patients are usually right. I say that all day, every day, when patients are like, I don't know, or they feel bad about saying, I feel tired all the time, or I have a headache, or my family, complains that I don't have energy, or I can't complete things. And I'm like, all right, let's work this up. And so I will often work something up to death to make sure that I'm not missing something, but because the patients are usually right.
Yes.
And
there is no, hey, I'll run this test and tell you it's actually chemicals in your brain that are making you physically sick, or it's your depression, or it's your anxiety, or it's a stress, or it's trauma. There is no test for that. I wish there was.
Oh, yes.
And so when you are presenting physically, there's a lot of exclusion that we're going to do.
First.
And many times it can be both. If you have carried a trauma with you long enough, if you have struggled depression, it can create other issues. It can create autoimmune diseases. There can be a lot of coexisting things as well. I have a young lady that's recently started seeing me, and she's been sick since she was 8, and she's about 20. She has some trauma, and she knows she has some trauma, and she's in therapy, and we're peeling back the layers and ruling this out and ruling that. And there's a couple things that look like this is going on, but it doesn't explain all the symptoms. And so I've been talking to her about, you've been carrying this trauma for a long time, and I think some of your symptoms are because of that. And then I think other symptoms, and it gets really hard. We always want one thing to explain everything. And it doesn't always work out that way. But when you carry mental stress, when you work in a high stress job, we have an episode talking about burnout. And many times burnout in a job presents as, I get sick with everything. My immune system's terrible. I'm run down. I keep headaches. I keep stomach aches. There's so many different things that can present. So Jane, we normally see it when people are presenting physically, and then we kind of have to peel back the layers of that. Tell us your experience as a mental health professional, how you see things present, how mental illness, mental sickness becomes physical sickness.
Okay, so for instance, if a child doesn't feel safe in their environment, then they get into the fight or flight, right? The anxiety starts, we get into fight or flight. And this goes on for years with many clients that I see, especially that have anxiety. And then what happens, and I know you guys can speak to this better than I can, but I'm getting ready to do some additional training in this. But the vagus nerve, when we live in fight or flight for so long, the vagus nerve, which is our rest and digest system, gets suppressed, goes a little more dormant. Mm-hmm. So they're stuck, like, after years of being in that, their body is stuck in fight or flight. So their muscles are tense.
And when you're in fight or flight, it's not just a feeling, it's a hormonal shift. You have certain neurotransmitters that kick in. You have Yep, you have cortisol levels, stress hormones go high, your norepinephrine, epinephrine go high. You're in the gotta go, gotta be ready. And so you can feel anxious from that, but also you cannot rest and digest. When you're running from a bear and fight or flight is not the time to take a nap or eat a meal. So you're not making digestive enzymes. So what happens if you're stuck in fight or flight? You can't digest food. You end up with a lot of GI issues. Your digestive tract move things through really quickly.
My kids call it bubble guts.
Bubble guts.
Okay,
there we go. That's a new diagnosis
For kids.
Yeah.
And they're like, oh my goodness, when I see a lot of patients and they have
like
tummy
the rumbling
aches.
and
They have the tummy aches and like they'll go to the school nurse for 15 times and it's because they're anxious and
stress.
So we call it bubble guts for little kids.
I like that. And you can end up like irritable bowel syndrome is frequently a stress in the bowel. We have a lot of the same neurotransmitters in the gut as we have in the brain. And so lots of times nervous stomach or people, when they get really upset about stuff, develop constipation or diarrhea, or people who are carrying trauma or people who are chronically anxious end up with really bad gut situations because of how much those neurotransmitters and chemicals act in both places. So it is when you're stuck and you can't activate your parasympathetic rest and digest, you have all the wrong chemicals for resting and digesting, so you can't do it. So you end up with a lot of stomach issues and you end up not having insomnia, not being able to get restorative sleep, which then creates its own problems. And, many times people think it's not all in my head. Look, I don't care whether it is an organic neurotransmitter hormonal thing in your brain or some other organ in your liver. And it is never all in your head. It creates a situation when you have stress in your brain and your neurotransmitters are reacting and your hormones are reacting. Those don't just act in your brain. They go everywhere. And so it 100% creates other issues. I think one of the things that we frequently see is chronic pain. There's some great research that supports that when people have an acute injury and they feel pain for a period of time, if they are under stress, if they have other mental stressors, then their brain becomes sensitive to that pain and it hyper regulates it. It's recognizing the pain to be more.
Okay.
And then they can't let go of it. Okay. And so why is it that some people's underlying injury can heal, but they still get the pain from it? Their brain is actually still picking up a pain message, even when they don't have underlying injured tissue anymore. And this is how some people's bodies and brains are working. So this interrelationship, it's the whole, the thigh bones connected to the, it's all interconnected. It is all interconnected.
Yeah.
And so, really the messaging to appreciate is you are no more or less sick if it started in your brain.
Right.
You are no more or less sick if it started in your body. But one will always affect the other, no matter which one came first. And if we really want to take good care of people, we need to address both. Even people who have had chronic pain, do I think that every person who has suffered with chronic pain should have a therapist? 100%. Zero exceptions. I would say zero exceptions. Chronic pain is a horrible, debilitating trauma of an experience that you can't do anything, everything hurts, and your brain starts hyper-regulating things. We can help you with your chronic pain by giving you tools. Maybe you can't fix the underlying broken in the body, but maybe you can help control your brain better to where it reacts to it in a different way. We can't always fix everything, but let's grab all the tools we can to try to get the best response. There are so many things where when the brain doesn't feel good, it makes the body sick. There are so many things when the body doesn't feel good, it starts triggering the brain in a bad way. There's any work that you have experienced. I think trauma is one of our bigger issues with this, where it really becomes physical for people. Any takeaways you think for that?
Well, I think with trauma, many times people end up with anxiety, really. So I utilize a lot of breathing techniques to try to reactivate the vagus nerve system, the parasympathetic nervous system. and to calm the body. It calms the brain and the body when we do the breathing exercises. Same thing with meditation, whether it's guided or you're guiding yourself through meditation. We have to calm the body and the brain down together. And those techniques work very well to do that. I mean, I use the technique called box breathing that the Navy SEALs use, and you can imagine what kind of stress they're under.
Yeah.
Right? So if
Yeah.
it works for them, I'm pretty sure it's going to work for most people.
I think so too. I mean, I don't know. Yeah. I mean, you and I have an exercise program a lot like the Navy SEALs. Yeah. I think, major messaging, important messaging is you're not going to be physically sick without it affecting your brain, and you're not going to be mentally sick without it affecting your body. So many times to just say, doesn't matter which one was the chicken and which one was the egg. Let's really address both is important. But the idea of really jumping in either place or both places. And I think if you're listening and you think, well, maybe my physical symptoms, no one's been able to piece together what is my underlying. In this country, we love to call it something and give it a pill. And so it's, what is the diagnosis? And you're frustrated and no one's come up with your diagnosis. No lab test has said this is what you have. And so it may be worth it to sit with a therapist and say, I hurt all the time. I'm tired all the time. What skills can you help to empower me to take some control back of my life? And start digging in.
I recently had a younger lady. I've only seen her twice. And her first visit, she was telling me everything that was wrong. And I don't even remember what it was, but whatever she said triggered something. And I asked her a question that I thought some of her symptoms may be trauma related. And with her being young, I didn't want to be like, well, this is definitely some PTSD and give her the label because she's young, and I wanted her to kind of feel it out. So I said, I'm not going to give you medicine right now. I actually did something that we use called GeneSight. I said, let me use this first. It's a test that lets us know if medications, which ones they could take and which are appropriate. But anyways, so I said, let me do GeneSight first. And I want you to sit with what we've discussed. And so I talked about what trauma felt like what would PTSD type trauma or chronic PTSD feel like, because her background and her story was very traumatic. And it was normal for her. So she did not realize that it was traumatic. And so she came for her follow-up so we could review her test. And she said, Amber, I left here and I thought about what you said. And she said, I could feel as soon as I started thinking about my history again, I started those symptoms. And she said, now that you've told me oh, well, that might be trauma. She said, it actually made me think about it. And I think you may be right. And she's like, I don't know what my diagnosis is. And we're still coming up with that. But she said, it actually made me take a step back and kind of process what I've been through.
Yeah.
And I think sometimes too, we don't allow people space to process. And, we want therapy to be available to everyone all the time and to have wonderful people like you in their lives, but often people don't. So they don't even realize, they don't even have the ability to take a step back or for someone to lovingly say, hey, let's not give you a medication at this point. Let's sit here and talk about this. And I always tell people, I'm a horrible therapist. I'm entirely too blunt to be a therapist. So I am not a therapist. I am not the one you need to talk to. But what you're saying sounds maybe like this.
And I think that a lot of therapists have had breakthrough moments with people where people have felt illness. They have had real physical symptoms. And when they have a breakthrough in therapy, their physical symptoms improve.
Yeah. Or she could tell. It was honestly reflexy type stuff is what she was feeling. So it's in her
choking
throat.
Up in her throat.
It was
no
in her
voice.
Throat. Yeah,
right?
it was in her throat. And she's like, I think something's really wrong with me. So she had worked this, she WebMD'd it and Googled it.
Yep.
And she thought, she's dying of esophageal cancer at 20-something years old. And I'm like, not that it's not possible, but it's very rare.
Yeah.
And so I was like, I really don't feel like that's what it is. And tell me why you think that. And anyway, so it was an interesting thing for me to be like, it may be, but I don't think so.
Right. Yeah. I mean, it is also connected. It's one of the reasons we haven't been replaced by computers yet and healthcare because everybody presents so differently. But the mind and body work together, and they will exaggerate symptoms. But so many times what's going on in someone's mind presents in their body. And our brains are so good at putting things in a safe little box and putting it away and going into a survival mode, that we frequently won't visit that. And then it becomes something of a physical symptom.
And we want you to get your physical symptoms checked out. Like, we don't want you to also
Absolutely.
not neglect your physical health because you think it's your mental health.
Yeah.
Right.
You know, our takeaway really today would be that as we sit here with one of our favorite mental health professionals, and we have so many people in our community that we appreciate and tap into, that the team of healthcare is frequently both mental health professionals working together with the primary cares and specialists, because it all works together so much. And so in no way do we want to say, whatever's going on is just in your head. It's whatever's going on affects your head, and whatever's going on in your head affects your body. And the two are very connected, and either place to start or both is a good place to start.
And it reminds me of one thing that you have said, Dr. Plaster, that I'll never forget. When we have a heart condition, there's no stigma attached to that, right? But if we have some kind of emotional issue or life challenge, there's a stigma there. And the brain is an organ too.
Brain is an organ. And what happens if the brain is the sick organ? It affects so many things downstream. Just like if the liver is the sick organ, it affects so many things downstream. Absolutely. And so there is no shame to figuring out what the sick organ really is and getting the appropriate treatment for it. Absolutely. Thank you so much for joining us as we really dig into some of these hard things about whether your brain, your body, or both need some attention. And if you do feel like there's been some issues that you haven't been able to find solutions for, sometimes looking at whether there could be something going on with stress or trauma is a good place to start to look as well. We'd like to leave you on a good note. So today's Tell Me Something Good is brought to us by our brilliant medical assistant, Adriana.
My something good is that I just had 4-month-old twins. And
Twins!
And although pregnancy was a little bit tough and the delivery definitely wasn't easy, the provider that I currently work with, Dr. Delp, his wife actually did my C-section, so that was great, and they're wonderful. I have a wonderful 7-year-old and wonderful babies. Going good.
Something good is kids, even twins, which can be overwhelming, but what a blessing.
Yes, they are.
That's awesome. Thank you for joining us today, and until next time, take care of yourself.